Hey guys, Vic from Airvol here, your trusted Canadian CPAP supplier, and in today's video we're going to go over how to access the clinical menu of your Loewenstein Prisma Smart. This is the menu where you can adjust your therapy settings. Alright, so first off, make sure your power cord is connected so your device is receiving power, and make sure you're on the home page of the machine. You'll know you're on the home page if you see the time displaying. If you don't see the time displaying, press the power button in the middle and that should take you to your home page. Once in the home menu, to access the clinical menu, you're going to press and hold both the menu icon button as well as the ramp icon button at the same time. You're going to press both of them firmly, and you're going to give it a few seconds for the screen to change. You will then see Menu Clinical appear as well as an unlock logo on the corner of the page. Above the plus and minus buttons, you are going to see a wheel icon and an eye for information icon. To get to the clinical settings, we're going to press the plus sign. Once in the settings page, your first option is to adjust the mode on your device. And these have to do with your therapy prescription parameters. So make sure when you're making alterations to your settings over here, you're doing so at the suggestion of your respirologist or sleep doctor. So at mode, you can select between the APAP, which is auto-adjusting mode, or the CPAP, which is a fixed constant pressure mode. So whichever your prescription suggests, find the appropriate mode. And then on the other side of the screen with the menu icon button as well as the ramp icon button, you can approve or cancel the selection. So we're going to press the approve selection. In this case, we approved APAP, so the next page is going to talk about the pressure settings. So since it's APAP, you're going to get two pressure settings, the minimum pressure and then the maximum pressure. So initially, it's going to ask you what your minimum pressure should be set to. You can press the plus and minus buttons to find the appropriate pressure. And then on the sides, you can approve or cancel that pressure. Once approved, the next setting is your max pressure. In the same manner, find the appropriate setting on your prescription, and then accept the setting. After that, you'll get to decide between the standard APAP algorithm or the dynamic APAP algorithm, which you can toggle between the plus and minus buttons. The standard algorithm is what we recommend most patients to start off on. However, if you're finding that the pressure wasn't adjusting adequately enough for your needs, you can always switch to the dynamic algorithm and see if you're getting better therapy using the machine in this setting. Once you found the setting you want, simply approve or cancel it on the side, just like your previous settings, and it'll move on to the next available setting, called Soft PAP. Soft PAP is a setting which is similar to EPR on RESMA devices, which stands for exhale pressure relief, or C-Flex or A-Flex on Respironics devices. It's essentially a setting that decreases the pressure during your exhalation phase. You can have this setting off, or with the plus icon, you can increase it to the maximum level of 2. You can have an exhale relief of 1 or 2 on these machines. Find the value you want, and then approve it on the side button. The next option is an unlock or lock option. What this does is, if you want to have the soft PAP setting accessible in the regular home page, you would leave it unlocked. But if you wanted it only accessible in the clinical menu, you would leave it locked. Once you have the setting that you want, you can move on to the next one. On this screen, you have Auto Start, which is the same as Smart Start on most other devices. This is an automatic feature that if you enable, your machine will turn on automatically when you wear your mask and it senses your breathing, and the machine will shut off on its own when you remove the mask and it senses that high air leak. Once you have the setting you want, you can select Approve and go to the next setting, which is called Soft Start. Soft Start is the same as your ramp setting, which the device will get to start you at a lower than prescribed pressure based on the time frame you selected. And then after that time frame passes, your machine will ramp up to your prescription settings, which were the initial pressure settings you put on this menu. You can select a ramp time anywhere from off, which is no ramp, all the way up to 45 minutes, which is the maximum ramp time you can have on this machine. Once you find the appropriate ramp time you want, you can approve it on the side button, and then it's going to ask you what pressure you want the ramp to start off on. 4 is the lowest possible pressure on these machines, so you can have it start at 4 or any pressures higher than 4 as long as it's below your prescription setting. Once you find the appropriate starting ramp pressure for you, you would approve it and move on to the next option, which is your tube diameter. Most tubings come in either a 15 millimeter or a 22 millimeter diameter. So depending on which tubing you're using with your Loewenstein device, you can select the appropriate diameter so it can calibrate for the pressure resistance needed. The next option is to unlock or lock that tube diameter setting. So if you have it locked like this icon, then you would only be able to change the tube diameter in the clinical menu. If you leave it unlocked, you could change it even in the regular menu. The next setting is your time setting. You can adjust your time here and then the minutes as well as if you want a 12-hour clock format or a 24-hour clock format. So whichever your preference is, you would select that and move on to the next page, which is your Bluetooth setting. You can have this on or off. You would leave it on if you use the Prisma app with the device. And then there is a diagnostic search setting as well, where the device will do some internal diagnostic features where it'll make sure your machine is working properly, and you can select the time frame in which you want this diagnostic done. On the next page, you can select your cellular modem to have it on or off. The cellular modem is a nice feature if you wanted your healthcare provider to be able to connect your device wirelessly. So if you wanted your respirologist to get your device remotely rather than bringing in the SD card to them for a manual data reading. So you can toggle this on and off depending on your preference. After that, the last option in the clinical menu is for your data. If you wanted to do a full reset on the data on the machine, as in delete all the information on it, you can delete it here by selecting yes for data delete. And that's it for the clinical menu. You're back to the beginning starting point. Once you're done putting in all your prescription settings, you can go back to your regular home page simply by pressing the Start Stop button over here in the middle, and now you're back to your regular home page menu. That's it for the clinical menu. We hope you enjoyed this video. Hit that like and subscribe button and stay tuned for more.